During my journey into the perimenopause, I was interested in a lot of lifestyle strategies that could help me improve my health, but also stay really productive, active, sleep well, and also help me function for as long as I can. One of the many things that women tend to fear is the word menopause. And whilst this can be negative in some people's mindsets, there is more and more conversation around this change and transition in life. There are lots of things that we can actually do as women to help ourselves age better. And so it's also important that we have information that is specific for women, tested on women, and studied in women. It wasn't only until 30 years ago that research specifically indicates that they should also be performed in women, particularly if the interventions actually would impact on women's health. So what's surprising is when you look at a lot of nutrition and exercise research, the data is mixed between men and women. However, sometimes there might be different responses between the different sexes. And so sometimes the intervention studied may benefit men more than women, and that might actually get mixed into the data. So when we try to apply that information to our day-to-day medical practice or our day-to-day interventions, it may not translate so well. And this is the reason why when I see women come into my clinic and office, they often exhibit or they often report a lot of frustrations when it comes to trying to implement different types of lifestyle strategies that they may have heard about in the media. So this is a video really where I wanted to share some of the data that are specifically done in women and how you can implement these things into your life so that you can age well. One of the reasons why this happens is because when it comes to studying an outcome, having different stages of the female menstrual cycle can impact on the response of a different intervention. So for example, if we were to look at sleep patterns, women actually do experience different types of sleep patterns during the different phases of their cycle. Now there might be some hormonal influences, such as the difference in the estrogen and progesterone ratios, and the relationships of these hormones with each other can affect our energy levels, it can affect our nervous system function, it can also affect our mood, and this is the reason why sometimes these things can influence the outcomes of some studies. However, this doesn't actually mean that we shouldn't study women, it's just that we should actually record the menstrual cycle as a vital sign. So for example, you would measure your blood pressure, your heart rate, and your weight. And for women, we should also be collecting data as to which phase of their menstrual cycle they are in, especially if they are also having regular cycles. In this way, we will be able to look at the data based on a woman's cycle and potentially have better information. The change in hormones can actually occur 5 to 7 years before the actual date of menopause. And so as these hormone changes occur, there are specific health risks, such as an increased risk of mood disorders, depression, anxiety. There's also an increased risk of dementia, heart disease. And also women are much more affected by osteoporosis. And there's another condition called sarcopenia, which is an age-related loss of muscle mass and strength. So I actually think that changing the conversation around menopause, where we can focus on how to keep women healthy, productive, and functioning well, is really important. As a woman, I think it's important that you feel that you're not alone in this journey and that you don't have to suffer through all these symptoms.